Hey everyone, I'm Taylor from Scan Strength Chiropractic and Scan Strength, like the fitness, wellness, recreational facility in Skaneateles, New York. I'm the chiropractor here, so we're going to go over some stretches for low back pain. A lot of times when I see people with low back pain, there's usually a preference of extension or flexion of the low back feeling better. So if extension feels better, then getting some movement into extension can kind of help get more blood flow to the area and more movement in general, which can kind of be a really good very first step to getting back to your regular activities. And then if flexion feels better, we'll kind of go over a stretch for flexion. And that's kind of the rounding of the low back here. We'll go over some of that stuff. So again, just kind of trying to get more movement into whichever area feels best for somebody that has low back pain. So I'll kind of show you how we can test out and see if extension or flexion feels better. This is Dan, he's gonna be my model. So go ahead, lay on your belly on the floor. So this one's gonna be for extension, a good test. So the first thing I want you to do is kind of get up and onto your elbows, good. So this is just kind of an active cobra pose or modified cobra pose because we're going from the elbows. So if this is feeling like pinchy or not good back in here, then flexion might feel better for you. But if this is starting to feel okay, you're feeling more relaxed, some more space, is relieving for your low back pain, then this is a really good one that we can go into. So this is the modified one. If that feels good, go ahead and go all the way up onto the hands, perfect. And then try to relax your belly toward the floor so some more extension can kind of be right in there, and that can be relieving for that low back pain. And then you can do a few passes, so you can kind of come down almost like a modified push-up. We call it like a prone push-up. Perfect. So that's the extension. So if extension doesn't feel good, then we want to move in ranges of motion that do feel good. So for flexion, we'll flip you all the way over. We'll go face up for this one, okay? So you can do, there's a couple different ways to do this one, but flexion is basically rounding the low back, okay? So we'll start with, you can grab both knees and try to bring both of them to your chest. You can either grab right over top of the knee, just like he did right there, or if that's too tough, you can also grab behind the leg, right underneath of there. Perfect. So that kind of helps you go into some lumbar or low back flexion. You can also have one leg out and one leg up. Perfect. So this one can go all the way to the ground. And then you can pull this one closer to your chest, which will exaggerate, at least on the one side, more lumbar flexion. And then you can switch sides as well. So if lumbar flexion feels good, then the knee to chest stretch might be a good one for you.